A lecturer. I'm a very practical, wet-handed doctor. So I do what I do, and I will share my experience. I'm doing this for the last 20 years, and I dealing not only with adults. I'm dealing with children problem. And
higher voice.
High voice. Okay. We dealing with the airways for the past 20 years. That's the way how we can develop and grow people right. So everybody who is in this room, mom and fathers, they want the child to be healthy, and that's our goal as well. As mentioned, Mr. Omar, and he was talking about from his own experience, because he went through lots of hardship in his life before he realized what was the problem. And the goal, what he actually doing for years now, it's amazing. It's a little story about me and him. I opened once on the internet and saw on one of the forums his video, Right to Grow. I'm like, wow. And I asked my clinical director, can you find who actually did this presentation? I like to connect with him. And guess what? We found his phone number. I don't know, she found everything. I called and said, hey, I'm the Dr. Pavlenko, and I'm Omar. Okay, so where are you? I'm in Edmonton. I'm like, what the hell? I was thinking he may be somewhere in Saudi Arabia or somewhere else.
Far.
Yeah, looking at his name, I was thinking, like, he said, hey, I'm in Edmonton. So we met like maybe the next day, right? And we started seeing each other and talk about, and that's how we created some kind of friendship. But it's not about this. We can go more. So we like to see healthy kids, and to achieve this result, sometimes we don't know what we're missing. Talking about what is the reason for why faces doesn't grow big enough, or right enough, or beautiful enough. Why not enough space in the mouth? Why teeth crooked? Why children do this? Why children actually open mouth and breathe with the mouth? Why are they irritated? Why are they developing ADHD? You have so many questions. It's become a really a problem in the schools and the kindergartens. And you see, and maybe you first had some kids like behave like kind of funny, and you cannot put them down because they just make how they do, and they put the label, oh, ADHD, and start feeding pills, which is completely ridiculous. It's not right. First of all, any study says you have to screen children or adults with any problem doing sleep test. Simple. Unfortunately, our medical system is not designed that way. And we actually starting giving pills, one pill, half for head, half for the stomach. This is applied to everything. I'm a doctor, and I know firsthand, and I'm very frustrated in the whole system. Anyway, so let's move on. I'm gonna go like ranting right now a lot about this. It hurts. So now what we see here, we're talking about golden proportions. Everything is symmetrical and has ratio 1.618, and that's width and length. That is the best proportion we see. Oh my God, this is actually look beautiful. And you look at face, look at petals and flowers, look at butterfly picture, whatever, or kiwi. Everything is that proportion. And this was built in ancient world was in that proportion as well. That's why we see all these arcs and domes, and they're like, oh, it's so beautiful. But nowadays we don't follow that. And as Omar said, maybe nature made mistake. I don't think so. Okay, we can move more. This is just another example, and you can see easy. This is not a healthy looking children here. You don't have to be a doctor, you don't have to be specialist on this page. You can see this is not something you would like to see in your child. Open mouth, head forward posture, always feel tired, and that's what we see very, very much in our society right now. You can move. On opposite side, you can see these faces. Basically, all these kids, they're my patients. I took them, took this photo, and they gave me permission to show faces. And now you can see children who actually was treated, or actually they were just to be normal grown themselves, but it doesn't happen very often. Maybe we have like 10–15% children who actually grow right. 85–90% children require braces. And we only know we have to put teeth straight, but what is behind this? Airways. Mr. Omar, 100% agree with him. Airways, nobody cares. Cares, but not that much. I'd like to have to more, and the parents be aware of all this. Anyway, so no more. Yeah, one more. Okay, you can move more. It's all about. I'm just talking about what is a reason for why we're developing those not very well developed faces. Why airway doesn't grow big enough, or muscle doesn't function right, and reason lack of breastfeeding. Excessive use of different type of sutures and bottles. Infant doesn't have to work hard to get milk anymore. And it's become a stigma because many moms, they just refuse even to breastfeed for some reason. And they have in societies not breastfeeding mom society. To be honest, it does exist. And they be offended when you start talking about it, as they just say, it is my right to choose. You're right, but your right to choose, and you brought child to this world, and now you have the right to choose what? Not to grow him right? Anyway, so enlarged tonsils, nasal obstruction, mouth breathing, allergies. This last one, this is actually one of the reasons why we develop in faces not big enough or not right enough, and airways. Food, it's a number one. Processed food, we cannot use our muscles properly, muscle doesn't develop good bone. Another big reason, allergies. It's a number one from all this. It says at the end, but actually it's not allergy when you have itchy skin, it's allergy which creates obstruction in the nasal passages. So instead of breathing through the nose, we start breathing through the mouth. Why it's so important to breathe through the mouth? Because nose. Because mouth is a filter, first of all. We are filtering all air come to the system, and we have good air come to our lungs. Second reason, we produce in our nasal passages gas. It's a nitric oxide. That's a gas, it's only developed on this area. And it's natural vasodilatator, it means it expander, vessel expander. If it goes to the mix, it creates a more efficient and bigger lungs opening, so we actually have more surface for gas exchange, and that's a big as well. So breathing through the mouth, it creates less oxygen in your body. Plus, because I'll show you one video. Can you scroll down? It should be some video somewhere. Okay, yeah, maybe somewhat later. So this is like we just talking about what is the most important. Mr. Alani, he saying, if he was talking about how much we live without eating, drinking, and how long we live without breathing. This is like really important to breathe, and why we don't pay attention enough to this area, and why we haven't not developed faces, and as a consequence of it, we don't have enough airways to intake enough oxygen or air to live normal life. So I will not do too much in depth what happened on the level of cells. I think it would be too much. I just want to highlight the importance of what we do, and after I will show you something, what could be done to it. So how could we prevented or even intercepted, prevention number one in my office. So we try to prevent, educating like you today. If a kid has problem with trying to intercept at a very early age, it will be very, very subtle intervention, like nothing to do like appliance or anything, but my facial therapist is the number one friend in our office. So I applaud ladies and gentlemen who does this, and they do a very good job actually to grow and direct right growth. So we having great friendship with those as well. Okay, we can move. I just like to show that video. Video probably somewhere, maybe it's later. Anyway, so this is something abnormal development that we're talking about. This is skull CT scan, and it shows kind of very look weird, almost like Halloween skull. And if you look at your child mouse, pay attention if a bite is deep. You don't see anything, you don't see lower teeth because upper teeth overlapping lower teeth. You see that kind of crowding, and you see like jaw smashed from the side. So it does not look normal even for individual who doesn't know nothing about dentistry or medicine. This doesn't look normal. Or we have big gaps here and tongue protruding. So something going on. On the other side, we see normal. We have good developed skull. We have good overlap. We have good proportion between upper and lower teeth. And the arch is big and very well developed. This is actually this part of the skull before industrial age. That means before end of 19th century. We had more better developed skulls than afterwards because of pollution. In Great Britain was the first developed how that machine was, steam machine, right? Steam machine, and they use coal to run it.
Yeah.
And for some reason, we see Britons, they have long faces, and they actually not really how they born, and that's actually how they develop because of mouth breathing, and face doesn't grow forward, it goes down, and they smashed somebody like, on the front. And those all people, we can see now that not only Great Britain, everywhere in the world, we have all these issues. And sleep apnea become, if not number one, but maybe number 2 or 3 reason for premature death or complications like stroke, heart problem, diabetes, depression, anxiety, kids ADHD. This has become very common, and we try to feed people, kids or adults, just with drugs, but we're not looking at the reason why we got to this point. And I agree 100% with Mr. Alani about telling, so we underestimate how face is important. Okay, you can next. Yeah, this is another one. This is one of my patients. We took CT scan, and that's what we see when you look on the side. Own tongue actually obstructing airways, which on the side of the on the back of the tongue. We have deep bite. Kid, if you look at kid with open mouth, that's again very common. Adenoids and tonsils create obstruction as well. As a part of allergy, you can move on. This is like very interesting behavior. We call it ADHD epidemic. And those kids we see, and I see in my office when they come and feel I cannot catch them in a chair because they're moving everywhere around. After treatment, and it takes not very long, as soon as you normalize breathing and start actually getting more oxygen, suddenly they become nice and quiet. Just like magic. And parents, what you did to him? I said, we just trying to get help, like my passion therapist, or we do very simple appliances just to help them to get through. And suddenly everybody's happy. Okay. This is a very good example. This is an old picture. It's on the internet probably for the past 50 years, at least. This is a story of one boy. He was 10 years old, and very nice developed face, perfect, no problem. And parents bought him hamster, right? That's a small animal, and he had allergy to it. And because of allergy, his nasal passages become obstructed. In a way, he grown up at 17, he completely different person. A long face, open mouth, retruded jaw, and he has sleep apnea.
So it affects the allergy affects the face and the teeth?
Yes. Allergy affects because we changing from nose breathing to mouth breathing. Nasal breathing is extremely important way to inhale air for different reasons. One is we clean air, it never goes, and your tonsils adenoid doesn't grow, otherwise they start taking, it's a second line of defense. If you don't clean to have those filters in use, in your nose, your tonsils takes over. Now you have tonsils. Now tonsils grow big. Now we have another obstruction. Now adenoids, it's in the top of it. And add to it lack of proper gas in the whole mix, we create less lungs expansion. So we have all different kind of bottlenecks during whole process. At the end, the kid or adult, it doesn't matter. If you chronically collect all this, one day you're gonna break. And how adult breaks? Stroke, let's say, because lack of oxygen creates excess of free radicals. Free radicals creates inflammation. Inflammation creates production of cholesterol and a lower level cholesterol. Lower cholesterol deposits on the walls and where it's heart and the brain, number one, the most fragile. And the walls become very thin. High blood pressure on the top of it, and you have whole recipe for disaster. I just had my friend 1.5 months ago on the Facebook. He said, "Oh, I'm just," and he showed a photo and everything else. I'm in the hospital. I have stroke. I'm paralyzed half, and he's just smiling. He's MLA. He was just elected recently. This man doesn't know how to stop. He just comes back at home at 12 and leave house at 5. That's his lifestyle. And I said, Andrew, you cannot run like this. I brought him in the office after 1.5 months, pulling him to come to do test. Guess what we did today? I opened my file after guess what? He has sleep apnea. Very fit man. Everything fine, but lack of maybe stress, he overstressed definitely, and stroke is one of the reasons. One of the comorbidities or sequence of sleep apnea. So I wasn't surprised because I knew he had it. And finally, we started getting treatment for it. Okay. Yeah, you can go for. No, yeah. Back. Yes. Here is a little bit. We go through signs and symptoms in children. What we have, that's something you can observe. Forehead posture, undeveloped jaws, flat cheekbones, long face, receded jaw, teeth crowded, mouth breathing, speech abnormalities, and that we call sleep disordered breathing or OSA. Now we have psychological component to it. We have poor attention span, hyperactivity, fatigue, dark circles under the eyes, poor performance in school, bad writing, light time grinding, bad breath, acid reflux, headaches. Yeah. By the way, kids never complain about headaches. And the reason why, because I don't know any other way to live. They may be born with headaches. And that's why if you ask, I'm asking questions, kids, I'm very careful. I'm not asking some silly questions because I know they're not going to answer because I don't know what is normal. They don't know even what doing for them. They just like, they don't know. And now, if you're not treated, that's growing as a growing human beings, that's what developed. It's a straight road to all this. Chronic pain, headaches, migraines, obstructive sleep apnea, hypertension, diabetes, cardiovascular disease, cancer, Alzheimer, depression, anxiety. On the top of it, social, family issue, disasters, because depression, anxiety, that doesn't create good relationship. I'm not talking about snoring. Like husband and wife has to live in different rooms. It's very often. Sexual life impacted very bad. Man with sleep apnea that doesn't is not good producer. Okay. Here is information was taken from reliable sources. You can go through like everything, so it will be easy. So whatever you see on the red, that's all connected to sleep apnea, and it's already proven by many studies. That's only, we don't know yet if it's chronic respiratory disease or pneumonia, but Alzheimer, diabetes, stroke, accidents. By the way, person who doesn't sleep and tired and he works as a driver, it's enough to snooze while you're driving half a second. That's it.
Yep.
And you're in a ditch or you kill somebody.
Yep.
But unfortunately, nobody cares. I'm asking those big companies if they actually do tests, sleep tests. They don't do for their drivers, like long-haul drivers. They should take every 6 months, I guess, or at least once a year, do sleep tests. Now we're wondering why. If you remember, it was a whole hockey team was killed on intersection.
Yeah.
It was a driver. He was driving, and most likely it was early morning, and maybe he was exhausted because he just missed and drove through intersection and killed so many young lives. We don't know. I'm just guessing. I'm not an expert. I wasn't that time, but I mean, I'm just assuming because so many stuff happening like this. We just don't know. Okay, can move on. More. Here is a full, just put all of it. This is, you can take actually photo of it, if you like. This is, you have to remember, this is what it is. We're talking about, I'm going to expand a little bit your knowledge. You're not talking about only sleep apnea, because sleep apnea is one of the diseases which cause other diseases, but we're talking about impact of poor craniofacial health and development, and what happened with that we're talking about. If you have small faces and small airways, we supposed to have all this stuff happening. It's on the level of psychosocial, oh, I'm sorry, it's on the level psychiatrical, psychosocial impact, on the level of TMJ and related problem, and on the level of tooth structure, and the level of what actually sleep apnea can do, and you can find all of it. You see ADHD, that's, you should be very careful, and we don't want your kid be labeled ADHD and after you're gonna laugh at him, because he's not behave like other kids, and it's not his problem. Unfortunately, that's what happened. And they start feeding pills, stimulants, which actually create other side effects. And after side effects, you have to pill for another side effect. And sometimes my patient coming to see with a list of medication. Like, I don't even know names, to be honest. I just look at it, okay. Get the airways in, get oxygen in your system. And all the time we have good positive results as soon as that eliminating the reason why it happens.
Is there, sorry, is
Yeah,
there
you
monitors
can move on.
if one can't get in through the pharmacy?
Yeah, this is specifically done, it's again, it's studies. It is official information from American Journal of Sleep, American Journal of Sleep. This is all information I took from them. And we only know one sleep apnea, but it's only on one of the conditions. We have tens of different sleep conditions besides sleep apnea. Like very often, patient goes and they give us sleep test at home. They're coming back, they the ship and say, "Oh, you have sleep apnea." Because sleep apnea, it is 5 or more events an hour when you stop breathing, and mild is from 5 to 15, moderate 15 to 30, and 30 and up, it's a severe sleep apnea. So, and they said, no, you don't have sleep apnea, you have only 4. All right, but we forgot about upper airway resistance syndrome. And the most prone to this, actually women. Women more prone than actually men, but if they diagnose them, they don't see that. They said, no, you're fine. How can I find it? Every morning I wake up and just barely holding myself. I have to put kids in the school. I have to do this and that. You're just pushing yourself through whole day, and after come back and exhausted. Okay, you can move on. You can oh, no, back. So this is actually shows how normal way of growth. To start with, this first one, it's actually 2 years old kid, and how much we actually adding to every year, and it grows forward. That means we have lots of space behind our lobed jaw, right there, and that's what we actually need. When mouse breathers, they grow vertically, so nothing forward, so airway is very narrow. And the reason why, because if they stop breathing through the nose, they start doing it through the mouth, and I'm hoping we're gonna get that video soon. I'm waiting for that video because that's gonna highlight whatever I say. I think it's at the end, because my clinical director, she put me, but I didn't check where she placed it.
Do you want me to look for it?
Maybe. Oh no, she didn't. Okay, go back. It's okay. Yeah, I'll do without. No, that was a good one. Anyway, so what we do in our office? They're talking about breastfeeding.
Should I do that?
Yeah, you can keep this. Breastfeeding, tongue tie. Everybody heard about tongue tie. Oh, my kid, they snapped his tongue when he was just born. But really, it's much more severe than that, actually just to remove this upper skin. This is very severe class 4 tongue tie. But sometimes you see tongue tie which is not very obvious for you. Like, okay, my kid's fine. But if you call it about posterior tongue tie, when tongue is not attached to the floor of the mouth, it doesn't have any freedom to place where it's supposed to be. I mean, in the palate, because it's a normal way you breathe. Sorry, to keep tongue while you resting. And the tongue is a big, powerful muscle, and it grows in a way how genetic blueprint told to do. So it's a normal size. When it's sitting in the palate, it forms and shape palate. If it's not in the palate, it drops down. It doesn't sit there because kids that cannot breathe through their nose. They have to breathe through their mouth. What that means, you cannot keep your tongue on the palate to breathe through the mouth at the same time. You have to drop tongue down, and what happens, cheek muscles and the lip muscles start pushing in. That's normal. You swallow, and it's in, but nothing to push out. So now I'm coming to the actual reason why people have crooked teeth or children, because jaw pushed in and nothing pushed out. So at the end, cheeks work as an orthodontic appliance, which creates small jaw. Our teeth, normal size, our jaws, smaller size than normal. That's why we have crowding. And very often they start removing teeth. Oh, you have too many teeth. Again, I saw today a girl, 17 years old, teeth being extracted. Still, I think it's a crime. It's a malpractice. They still do it. Terrible. Okay. So this is what we do in the office. We do this kind of questionnaire, pediatric sleep questionnaire. We're asking parents how your kid behave, what they do, what you observe. Really, you cannot ask kids those questions because they have no idea. Kid 5 years old or 3 years old, how you can ask? But parents come to play. And we use this as a guide. This is an internationally recognized form. So we know, and after we assess, we add to it CT scan. I do CT scan from the children from 5 years old and older, which is I assess airways, jaws, growth, and joints. Extremely important that for diagnosis, especially when you cannot even look in a kid's mouth. But they have to be old enough to stay still. That's kind of like only reason. CT scan is very ecological now. We use it in the dental business because before that it was quite big radiation. Now it's very safe. My patients ask how much radiation I'm gonna get. I said, if you fly from Vancouver to Toronto back, that's exactly what you're gonna get. Because we get radiation flying on the plane every time. Okay, and this is actually, it's funny. This is my hygienist son, and here is my clinical director's son. This one man 25 years old now, and this one probably like 12. But he's that way how I saw him. He looked like he's gonna die very soon. Oh. We treated him. He's good now. Okay. This is what equipment we use. We use a sleep test, and it's very easy. You have to put only a ring on the finger and connect it to your smartphone. Very big accuracy, as good as any sleep test you can sleep in the clinic. And the most important, it's very convenient because kids, especially for kids, you cannot put kid on all the electrodes and ask him to sleep. No way he's gonna sleep, but he can sleep with this.
Yeah.
Where do you buy this?
Huh?
Where do you buy it?
Oh, it's professional. You can actually use like iWatch, this some, but this is actually more in depth. It's based on the cardiopulmonary algorithms. It's much more complicated. They just count how many oxygen you have and the heartbeat. That's what I like. Apple Watch, probably for your use, perfect. But for professional, we look at the brain, we look at other stuff. Okay. Yeah, this is all kind of appliances we use. This for kids, no, just follow. Like we use appliances, very easy to use, like my brace appliance, for example. You can exercise with kids, for example, playing with them, giving proper exercise, or we refer to myofascial therapies in the severe cases. And that's what we talk in intercepting or preventing. Okay, more. This example, this is my clinical director daughter. And I want to give you an example, and you can see easily recognize what's wrong here, based on what I told you already. Just look at those words.
Keep covering the bottom.
Here we go. Good job. Yes. So number one, right? It's a very obvious. And what else you see here?
Crowded?
Yeah, crowded already. So kids should have spaces normal. If you see in the mouth of your kids, if you see 5, 6 years old and his baby teeth together, there's going to be already a problem. Adult teeth will come in the mouth and there will be no space for them. So you should see spaces. That's a healthy situation. If it's not, you have to look for a solution, because most likely they're going to grow up and start having adult teeth, and it will be crowded. It's just science. So, and this is like her symptoms. That's what she experienced. Head work posture, it's another big one. Look at her head position. Look at the eyes, they look tired. It's like droopy eyes that we see all the time. Adults or children. You see gummy smile, it's another sign. If you see kid, they see like big smile, that means he grows down. That's already not normal. You should see normal amount of gum. Okay, you can move on. Yeah, here's my grandson. No, I'm not here to show off, but I mean, it happened to be, they're the same age, by the way. They're friends, both of them. But look at these moms, right? It's quite different. Big spaces, look, not only here, but here. Oops, sorry, can you go back?
Yeah, because it's the touch, you could change.
Yeah, I'm sorry. Yeah, you see the big spaces in between, in the front. That means he won't have any problem. And if I would bring you, now they have actually adult teeth coming up, she doesn't have any space, he has severe crowding. This man already developed right. We knew he's gonna be right. What we did for him, at 4 years, 3 months, he was already eating meat on a piece of bone. We start giving them everything because his grandpa is smart, right? So I said, okay, and he was given hard food to start with. And parents very afraid, oh, what if my kid gonna choke? Never. Till 6 years old, kids have extremely strong gagging reflex because they learn how to breathe and take mom nipple at the same time.
So
can you do that? No, but kids can do it. So don't afraid to give them food. Oh, okay, don't give them like very tiny piece of toy because they're gonna inhale, it's not good. But they will cough it out. But that's gonna start making them even don't have teeth. At 4 months, 3 months, you have no teeth. You can do it. Yeah, that's what you did. I don't know, if it's that, maybe something different, maybe my genes. Who knows?
He's inheriting.
It's your
DNA. Maybe I'm good, but I'm opposite. Actually, I'm a DHD kid. I was growing DHD, but I didn't know that time. I was bedwetting until 13 years old. I'm still very funny acting with my body language. I think I still have remnants of that. Anyway, so this is just we put together two cases. This is him, this is her. This is her, this is him. And you can see sides of arch, nice broad arch. I guess, do you think he keeps his tongue on the palate? Most likely yes. Do you see she can keep it? Most likely no. Look at overlap. Look at this healthy bite. That's what you should look at. He actually, he had posterior tongue tie. I'll tell you a family story. Like mom always protected. As soon as he born, and I look at his mouth first, like he just brought him from hospital. I'm like, okay, here's tongue tie. And the grandmother is gone. And my daughter-in-law, she was mad at me. No, she didn't want me to do tongue tie. And now, and my son, yeah, okay. Anyway, so we didn't do it now. He said, yeah, he has tongue tie. We've done everything except tongue tie. And I see his tongue tie pulling his jaw backwards now. Something not done in time. Anyway, this is just my story. This is actually a result of sleep test. This is a result of one of young children. This is, it says HI5. It depends from HI5. Let's say, what's mean HI? It's apnea hypopnea index. That means how many times an hour you stop breathing. More than 10 seconds. 10 seconds and more, that means you have apnea episode. And that's how it counts. If it's 9 seconds, no, you don't have sleep apnea. Or you have like 1, that means you have no sleep apnea. In kids, the parameters is much lower. If it's children, you have 1 episode of sleep apnea, you already have mild sleep apnea. And in adults, if you have from 1 to 4 to 5, it means you have no sleep apnea, because kids even more sensitive to lack of oxygen than children. So than adults. That's why from 1 to 5 it's a mild, from 5 to 10 it's a moderate, and from 10 and up it's a severe. In adults, that's 15, it's a 30 and up severe. In children, it's a 10 and up severe. That's how kids, their brain sensitive to this. That's why they develop a disease. That's why hormonal levels go up. That's why they start not growing enough, because growth hormone actually produced during nighttime. If you don't produce, if you have bad sleep, don't go to deep sleep, you never produce growth hormone. Kids grow not as normal as it should be. So if you see a small kid and he's kind of like, yeah, maybe he got something. And I saw many cases, if you've done treatment and see them in 3 months, I couldn't recognize them. They grow like weed. Because you don't have to go to deep sleep. Deep sleep produces growth hormone. Yeah, so that's just another example of different obstructions. That's what we see all the time on the CT scan. That's another case. 8 years old, deep sleep, head-forward posture, retruded jaw, whole bunch of problems related to it. Not doing very well in school. Mom says she doesn't pay attention. So this one, next one, go next one. This one actually, I think 9 months later, the same girl. This is everything whatever we saw before is gone.
What did you use with her? Like BioBrace, BioBlock?
No, not my. I'm using a sagittal appliance called Raka. It's a removable anterior growth guidance appliance.
Like a DNA?
Kind of DNA, but not DNA. Okay. I would say something. I use DNA as well. I'm using DNA. But this specific case, if it is pads, I mean, build up on the back teeth and growth appliance.
Open to vertical, brought it forward.
No, it's an operation. You mean operation surgery?
You mean how do they, after treatment? When it says treatment, what do you mean with treatment?
Treatment, I think it's the next. Okay, this is an internal appliance. It actually stimulates growth, and it not stimulates growth. It actually directs growth. Because if you remove all this bad stimulus, interferences like Mr. Alani told, in his case he told you about headgear, which is completely ridiculous. But in our case, actually, our own body can interfere with us. We're removing all these stops. We open bite. We actually creating situations for growth. And we have appliances stimulates growth. I don't want to go to details because I have to take another few presentations for you. But it is everything we do in the office is conservative. I brought here only kids. We do the same for adults. But just different appliance, a different way, a little bit more comprehensive, I would say. But you don't have to use CPAP machine like you say, oh, I have to use CPAP machine, that's it.
Is it like by exercise, teach her like the kind of, like the way she has to
Exercise
breathe?
as an auxiliary, yes, but not main treatment.
Oh, okay, like
We have certain base appliances that actually does that job. But exercise, yes, 100%. It's very important. All our kids exercise. By the way, I will tell you one thing we do for everyone, adults and children. We teaching children to breathe through the mouth, taping mouth. Sorry, nose, taping mouth. We tape it just as a surgical tape. Tape mouth, go to bed. Very simple. And if you go back, oh, I should bring you everyone this. I forgot. You probably should take it and tape your mouth and go to bed, and you will see yourself next morning how you're gonna feel. You're gonna feel better. I'm taping my mouth every night. Yep, that's every night. You don't tape, right?
Try it.
You taping or he taping as well? Because I told him to tape. No, really, because if you tape your mouth, you create a new habit to breathe through the nose again. You have to start using nose again. If you don't do that, that means you are already in trouble. So, and a simple way to do it is tape your mouth. If you don't like surgical tape, you can use duct tape if you like. It's up to you. No, I'm joking. Don't do it. Because you okay, doctor told me that. Okay. It's again, that's cool. Yeah. It was, and now go back.
Arrows.
No, back, you forward. All right. Anyway. Okay, because I didn't show you that video. Can we go? Maybe we need some video. It was that video there. I'm not sure why we don't have that video. Can you scroll quickly? Just one. We missed somewhere video. This is something wrong. What you've done? Before you come, it was everything fine. Okay, good. Okay, let's scroll. I missed somewhere. It's a good video.
Is it the one of the
Yeah, that should be a link. If you saw it, okay. Maybe. I don't know. Because it's supposed to be here. She missed, I think, and she just removed.
This one? That one, Statistics Canada?
Oh, no. Oh.
This one? Do you want me to try it?
No, maybe no, it's not that one. No.
Oh.
It should be like a full screen. It actually shows Statistics Canada.
Maybe later.
Okay, more.
See, there's no.
It's actually good for you to review. Go ahead.
Yeah. Study up.
Just kind of like.
The review.
Too bad. It seems like she arrived. Okay, I'm gonna show my hands. Forget it. Just forget it. I don't think she forgot to put it on. Yeah. This is a good one, right? Oh, actually, previous one we missed as well. Can you?
This one?
One more.
And one more. Yeah, so this one. This is that girl. I told you. This is before airways. Here is after. Here is a different view before, here after. If you look at this one, you can see adenoids. And here is no adenoids anymore. We don't remove adenoids. They shrink themselves.
Yeah.
Because nasal breathing creates purification, and the adenoids don't have to grow anymore because there's nothing to deal with.
Right.
You see what I mean? This is like 9 months difference between those two. All right, so next I will show you this.
You're changing lives, Dr. Alex, right? You're growing kids at the young age so they're good, healthy adults.
Yeah, basically we prevented them to get to the trouble when they get adults. And they basically growing nice because if beautiful stuff about kids, they don't even know what we've done for them. Have no idea what we've done for them. Because they will never experience what they would experience. Yes, you're right. Basically, we're trying to do that. Anyway, so this is like more talking about craniofacial dysfunction. And that way, what actually we trying to highlight for the specialist. This is actually part of presentation I did to pediatricians, but they don't listen to me. I did presentation with my son, 1.5 hours, and nobody called me next day. Nobody even tell. We just like, we chew for them. Like literally chew, just swallow. Zero response. And they see those kids every day. And it's, yeah. Anyway, happy steps. Thank you for attention. If you have any questions, you can ask.
Thank you. Dr. Alex.